Oh no.
It's just about it getting older.
Ah, look at everybody showing up. This is great. Yeah, it sounds like, I think tight hamstrings might be from sitting a lot.
Yes. And then it causes back issues. So, but I don't know. I don't sit a whole lot. Well, recently I have with all the legislative stuff, but
Right? Yeah, that's kind of what I was thinking you probably had been.
yeah. Well, I can't get my camera to open, but seriously, I am here.
Yeah, that's okay. I know a lot of people don't tend to get on the screen anyway. Definitely prefer looking at everybody, but I get that there's some shy people out there. Like somebody else is admitting people, so thank you, whoever is admitting people for me.
I think that's me. You're welcome. It keeps popping up.
That's great. Oh, now it's 2:00. There we go. Seems like we just did this, doesn't it? Awesome. So good to see you all. Since it is 2:00, I would like to get started. I like to start on time so we can end on time or early. And I would like to see, is Marcela Nava? Are you on, Marcela? Yeah, I see your name. Great. Okay, very good. Thank you for being here and welcome everyone, especially if you are new. We are thrilled that you are joining us and very excited to have our speaker today. It's oh, where's my agenda? This meeting is being recorded, by the way, if you didn't notice. I like to post the speaker portion of our meetings on our YouTube page. So if you do ever miss anything, or if you want to see what has happened in the past, be sure to go to our YouTube page and watch some of our videos. And with that, I am ready to introduce our presenter today, Marcela Nava. Dr. Nava is a health equity researcher who studies the political economy of health and public policy to look for what works in reducing health inequities and protecting community health. She is a Robert Wood Johnson Foundation Health Policy Research Scholar and Assistant Professor in the School of Social Work at the University of Texas at Arlington. She has a PhD in Public Policy and Political Economy and a Master of Public Policy from the University of Texas at Dallas, a Master of Science in Social Work from the University of Texas at Arlington, and a Bachelor of Science in Social Work from Texas Christian University. Her current research focuses on the intersection of political, economic, and social contexts of immigrants and other marginalized groups in the U.S. She studies the way that institutions influence health to develop multi-level, innovative, and common sense approaches for community health improvement. In the past, she practiced social work with homeless and runaway youth families at risk of child abuse and immigrant and refugee communities, and oversaw various federally funded community-based participatory research projects focused on women's health. As an educator, she teaches graduate and undergraduate courses in social research methods, immigration, health policy, and community-based practice. With that, I introduce Dr. Nava. Dr. Nava, the floor is yours. Do you have a presentation to share?
I do.
Okay.
Can I share? I think I can share from here, right?
You should be able to, yeah.
Okay, let me see.
Looks like it's coming up. We see
Okay.
your screen.
Okay. Okay. I don't think I started on the right slide. All right. Well, hi everyone. Thanks for having me today. So I don't know that I'm talking about necessarily anything drastically different than some of what I know that you've already had a chance to talk about, and I'm talking about in different settings. Several years ago, I had a chance to work with the late and the amazing Don Smith on several projects here in the United Way and the Area Agency on Aging. And as we were sitting around in one of our many stakeholder meetings, gosh, this would have been, I don't know, maybe back in 2015, 2016, just sitting around trying to think about different frameworks, different approaches as the conversation was really ramping up around just cultural competency and cultural humility. And there's a lot of reflection about what does it mean to do this in the space of working with older adults and preventing the exploitation of older adults. And we stumbled, and not necessarily stumbled, I mean, they'd been around for a while, but one of the frameworks that we came across that really resonated with us was this framework of the CLAS standards. And I think many of you have come across these or maybe sat in a presentation about these, but they became this really helpful tool that began to guide and shape a lot of the conversations we were having there, again, in our stakeholder meetings, and really found that it was a helpful place to create some common language to talk about what does it mean to be culturally competent or to have cultural competencies in spaces of working with older adults and preventing exploitation. So we ended up doing quite a few different types of workshops and presentations that use the CLAS standards as a basis, and found just really great response to them. So when I was asked to come and speak to them, I don't have, what I really kind of wanted to do, and, just since I know that there's a lot packed into the agenda, I wanted to be brief, but really just kind of bring this, since I don't know how familiar folks are with the CLAS standards or just some of the ideas embedded in there, just to really introduce and to kind of underscore the idea of the fact that there's no magic pill, there's no magic solution, there's no aha, this is going to fix and address every issue that we have in terms of reaching and being able to, fulfill our mission for diverse groups and audiences. We know that we're in a very, very complicated social and political environment right now, which makes this kind of work even more challenging. And so really, what I hope is that really maybe this is just kind of an opener as, again, here's one of several tools out there that provides a nice framework, a nice package of ideas to think about that don't necessarily have health equity and health disparities and all of the buzzwords that we know are getting a lot of kind of public censure written on them. It's a tough time. It's a very tough time to do this work, but I know that everybody that's doing this work wants to make sure that every single individual has access to the same types of protections and the same level of quality of services. So I hope that this can maybe spark some ideas and maybe just encourage you to find ways to have this conversation and to advance this work and to do so in a way that protects you, that protects your organization from backlash, but still recognizes how important it is to do that. So with that, again, I'm not going to say anything incredibly, revolutionary today, but I hope that it opens up the door to some conversation. So so I'm going to just talk briefly again about the CLAS framework, just to introduce that if you're not familiar with it, just touch base in terms of how it connects to the work that's already taken place with the TEJC, maybe highlight a couple examples of what it might look like in terms of application, and then maybe offer some kind of suggestions for how to take this and go and extend it beyond. So let me see. So the CLAS standards, again, this is kind of a good recap for folks that are not as familiar with it. The CLAS standards were a set of standards that were developed by the Office of Minority Health back in 2001. So they've actually been around for quite a while. These standards were an attempt to come up with a consolidated set of guidelines that basically answer the question, what does it mean to provide culturally and linguistically accessible and appropriate services, which is a really, really broad and difficult idea. So when you think about the work that's taking place in early 2001, this is a few, 4 or 5 years after welfare reform. There's a big emphasis on how can we create a more consolidated and consistent approach where there's maybe more of a universal understanding of here's what it means to be accessible and to provide services that are that people of all cultural and linguistic backgrounds can access. So a lot of these standards were really framed originally in more of the hospital and the healthcare context, but more and more you see them extend beyond that because again, like we're providing multiple services. It's really important that as we're collaborating so closely, from public agencies to social service, community-based organizations to healthcare systems, it's really important that we have some consistency and some in terms of the standards that we're looking at. So these standards came about in 2001. They definitely took off a lot more after the Affordable Care Act was passed, and you saw these get revised and amplified and pushed out quite a bit more. And again, for in many respects, you saw folks that saw these as standards, and we'll go through the specific standards here in a second. The standards to really think about how they applied and implemented. There's been a lot of work since then that has looked at what is happening now with these standards. There are certainly folks that have some concerns that have said, hey, here are these standards that have been out there, but what does it really mean to meet this standard? Are we actually addressing some of the root causes of the disparities that we're observing? Is this becoming more of a performative practice where we check off the box and we say we do this, but does it really lead to some meaningful change? Or are we able to evaluate how well we do it? So there's still a lot of, I think, questions and a desire, kind of if you dig into the literature and the use of these standards, to want to make them more consistent in terms of how they're being implemented, how they're being evaluated, but certainly the framework itself has been consistently held up. And so you see these standards really focus on 3 main areas. One of these areas is related to governance, leadership, and workforce. So it's related to the organization itself. Who is in charge of the organization? This could be who sits on the board of directors. This could be who are the people that are in decision-making roles. What does the workforce look like and how does it reflect the population that it serves? There are a lot of standards that focus more on communication and language assistance, which again is fairly self-explanatory there. How are things being communicated for people of different languages, of different communicative abilities? And the engagement continuous improvement process. How is there accountability to the community, to the clients that are served? How are relationships and authentic and meaningful relationships maintained with communities? And how is the organization working on continuous improvement? So you see, this is it's not very different, but a lot of the times in the work and the trainings that we've done, when we hear things that use the word, cultural and linguistic and cultural competence, oftentimes there's an assumption of, there's certain activities that I need to do, certain questions that I need to ask to make sure that I'm responding appropriately to people's different cultural preferences or needs. And that's certainly an important aspect. But what I really like to think about when I think about CLAS and when I think about these standards and just this type of work in general is really just this idea of a big iceberg. And the reality that in this iceberg, what we see and the work that we do is really just the tip of the iceberg. What our clients see, that face-to-face interaction that we're having, that program that we're enrolling them in, the services that we're providing, the assessment that we're conducting, that's the tip of the iceberg. That follows several decisions that that have already been carried out and continue to be carried out relating to continuous improvement, relating to leadership, relating to authority. So rather than focusing on the tip of the iceberg, which is where I think a lot of our conversations kind of tend to take place, I really encourage you to think about this as looking beneath the surface of the water. and really thinking about the many, many aspects that happen upstream that our clients and our stakeholders in the community may not really be aware of. So again, why CLAS matters now. Again, kind of hinted at this, but we're in some very, very challenging times politically and socially. I don't know kind of where everybody is in terms of their work, but I know that I've already had at least one grant that I was working on be suddenly axed, and it's a very scary time for a lot of folks that have been doing this work where there's now a question of, can I even make this a priority? Can I even use words like equity or disparities, and without risking backlash? As a social worker, I'll tell you that this UTA School of Social Work, we're seeing a lot of pushback, not just happening now in terms of federal government, but in terms of the state government, in terms of what we can even talk about and teach about in the classrooms. So while I agree that it's important to have these conversations that bring to light what are we teaching and what are we doing, it is a time that's certainly raising a lot of alarms in even just the core of social workers and other professions that tend to have a social justice or a type of equity balance in it. And the concern here is that, again, we are in Texas. Texas has a very rapidly growing and diversifying aging population, and so for aging is one of the biggest inevitabilities. And I can't speak to the inevitabilities. And so, whatever the decisions that we're making now are going to shape the health and the well-being of the individuals that, especially again in gerontology and workforce that serves older adults, are going to be the older adults of tomorrow. And so it's a little bit it's important that we think about this work as taking place not in isolation from a lot of the other types of equity work, but that we realize that whatever consequences are happening right now, I'm hearing from social workers and different individuals about different gaps and about different gaps and issues that are taking place in terms of people being scared to reach out and ask for healthcare services, that are people that are potentially in situations of violence and exploitation now that are concerned about reaching out for help because of, say, immigration status or criminal status or other types of legal or political concerns. Well, these individuals are very likely going to take these same issues of safety and health and exploitation into their older adulthood. And so, so even though it's a scary, scary time for a lot of us, I just think that it's very important that we have these conversations and we figure out, what does it look like to do this work now, in a way that protects us as individuals, as professionals, as organizations, but that also doesn't that allows us to continue to advance our missions of making sure that we're responding to the needs of all individuals, regardless of where they fall in kind of the political and social spaces of today. So kind of mentioned that already. So I wanted to kind of walk you through then a little bit of these standards, and just kind of give you a sense of what they talk about, and maybe have you, as you're going through these, reflecting a little bit on what this may look like or sound like to you and your agency. So there's CLAS standards provide a principal standard. This principal standard is kind of the standard that can be said to kind of encapsulate most of the other standards. That's to provide effective, equitable, understandable, and respectful quality care and services that are responsive to diverse cultural health beliefs and practices, preferred languages, health literacy, and other communication needs. There's a lot packed in there. So one of the things that I think is a really great exercise that I encourage folks to do that want to, think about integrating CLAS standards in any level of work that they do, is to just sit down with it and have a conversation about it. Say at a staff meeting, really kind of picking apart with all of these terms. I mean, you can look up definitions, you can look up the federal agency's definitions, but what does this mean to you as an organization? What does it mean to be effective? Does that include evaluation? Does that include certain metrics? What does it mean to be equitable, and how are you measuring that? Is this equity in terms of outreach? Is this equity in terms of outcomes? Are you looking for similar outcomes for similar groups? Are you looking for similar rates of who's accessing services? Are you looking at equity in terms of staff? So equity can mean several different things, and generally, if you ask 10 different people, you're going to get 10 different answers to that question. Is it understandable? Understandable to whom? Things that are highly understandable to one individual may not be the same to another individual. And that goes beyond simply thinking about linguistic ability, but that can also be the kind of cultural context of things. When you look, that can be related to social factors of the assumption that certain concepts and certain values are inherent to others. So things that we find to be understandable in a way that we don't question may not be the same thing. So, quality care, responsive, diverse, all of these are things that can be multiple things. So definitely encourage you to sit with that. Now, in terms of governance, leadership, and workforce, you see that there are very kind of specific things there that that fall under this. So CLAS things about governance, leadership, and workforce in terms of the board of directors, or the whatever type of leadership structure your organization has. How does that structure, how does the governance and the leadership structure promote CLAS? That means, is it, for example, reflected in a strategic plan for the organization? If in situations where there's an organizational plan, are there individuals that have this type of expertise on your board of leaders, on your organizational leadership? Is that considered to be a priority? Sometimes there's bylaws, that reflect specific priorities. What are the considerations? Again, we know that right now there's a lot of concern about hiring and workforce and what that means in this context of what's DEI, what's not DEI, but to what extent, outside of looking at specific metrics, such as we want to hire an individual that looks like the community, well, that may not be as relevant or safe, a conversation now. But what about hiring an individual that has lived experience in a given community? What about, just like you might hire for a peer support specialist, as somebody that has lived experience battling a certain type of disorder or a certain type of experience? Again, thinking about how you hire a workforce that's not necessarily reflective of a specific racial or ethnic or gender group, but somebody that has lived experience with specific issues in a specific neighborhood and with a specific population. And you see a lot of this in conversations around community health workers, again, individuals that have skills that they may have acquired they may not have acquired in a formal educational context, but they are skills nonetheless that allow them to really be able to carry out the mission of the organization. How does that education and that training take place? What type of education is given to individuals on aspects of culturally and linguistically diverse services? Is there the standard, kind of, here's the training that we do so that we can kind of protect ourselves legally and socially? Is there a level of immersion that occurs? We really want part of your training and your onboarding to be to really get immersed in certain community contexts so that you understand where people are living and what that community looks like and feels like. How are you familiarizing your employees and making sure that they have the skills to carry out this work? Communication and language assistant, that can encompass multiple things. At a basic level, we know that this can encompass offering language assistance to individuals with limited English proficiency at no cost to them, and in a timely manner. This is a really challenging thing because this has been there's been civil rights protections for decades that require this type of access in hospitals. But anybody that's been in a hospital at any point knows how challenging this can be. And I know, I've got personal anecdotes, I'm sure many of you do as well, of just seeing maybe the struggle that individuals may have to have the services. Sometimes we know that it's difficult to find an interpreter that can respond in a timely manner. It's very, very difficult for health providers to balance providing services when they're, again, under very tight timelines that require this. So we see a lot of shortcuts taking place. A lot of times it's tempting to rely on family members or children, and that can be particularly concerning, especially right in cases of exploitation. So figuring out what does it mean to do this and to do this well may look very, very different from one organization to the next. It could include the use of individuals. It could include the use of technology. It certainly, includes the use of different types of policies and practices, but there's also that accountability mechanism. How are you ensuring that this is taking place on a consistent basis? And when it does fall through the cracks, how do you ensure that there is accountability to respond to the cases when it does? How are individuals being informed of the availability of this? Is it expected, that people must request these services to be available, or are they informed from the very beginning? Even, are there partnerships? Are these services that are taking place in places that are accessible to them? So thinking of how individuals, even the steps that they take to require that, is an important aspect of accessibility. Again, who's providing that language assistance? Are these untrained individuals? I'll tell you that as a native Spanish speaker who, the majority of people in my family still speak Spanish and are primarily Spanish speakers, there are many, many things that I've been asked to translate or interpret that I absolutely, even as a trained, competent individual, I don't have the competence to do that in Spanish. And in my first language. And it is, but yet again, it can be very challenging to then turn away and not provide that assistance when there's nobody else available to do that. So recognizing that there are, and many times, especially when it comes to individuals who are employees who are bilingual and who have additional skills, a lot of times these are individuals that end up getting overtaxed and overburdened by providing a lot of translation and interpretive services that may go beyond the scope of their work, that may not be recognized as part of their official duties, and that may in many ways undermine the perception of the value that they bring to the organization. And so that's a very tempting thing that's very tempting to over rely on individuals with multiple language skills and organizations, but that can be very, very harmful to the workforce, to valuing individuals with those skills, and to their retention. And then, of course, providing easy to understand information that's accessible. And then finally, the engagement, continuous improvement, and accountability. This really focuses on, again, this kind of larger idea of how do you ensure that this happens on an ongoing basis? What types of goals have been set by your organization around this? Are there goals? Are there policies? Is there any kind of accountability mechanisms? If you have a quarterly review of, I know, kind of terminology varies, but if there's types of quality improvement meetings, what standards are there that reflect these types of goals? Are there assessments that take place that monitor how well the organization is doing? Is there demographic data that's being collected? Sometimes it's as simple as saying, can we look across our different demographic data and look at our different social groups and look at how well are we doing in terms of not just getting them into services, but getting them to complete services? How well are we doing in terms of their outcomes? Are there concerns that we may have where we may need to make modifications in how we reach or how we engage or how we sustain in order to make sure that we're really pursuing as much equity as possible? Are there communities that we can partner with? Oftentimes, one of the difficult things is to acknowledge is that we can't do it all, nor should we do it all. I know at one point I was running a community-based program that included myself and the other person that I employed. We were both bilingual English and Spanish speakers, but we had a really large population of individuals who spoke Arabic in the community that we worked in. And rather than try, and we certainly had a few fairly terrible attempts at trying to navigate services through an AT&T language line until we realized we were doing as individuals a disservice. So we actually created a partnership with an organization that targeted primarily Muslim individuals, and most of the staff members there were Arabic and spoke Arabic languages. And so we were able to create a partnership with an organization that had all of the strengths in terms of its employees, its language, its cultural knowledge that we can bring, and therefore ensure that through these partnerships, we could provide equity and not just see it as something that we had to do ourselves. Again, conflict and grievance resolution. What do you do? What options do people have when they feel that they haven't been responded to in an equitable manner? Are there processes? Are they informed of those processes? How are those processes handled? What communication mechanisms is there? So a lot of these questions that are embedded. Um, so so a lot of this, I'm going to kind of skip past a couple of these examples. But one of the things that I kind of just want to talk about, a couple of the last things I want to mention is one, what does this mean in terms of just the different individuals that are participating in doing this work? So again, if we're looking at adult protective services, how are you tailoring these kinds of questions and conversations into assessments and into safety planning? What considerations are taking place and our community-based outreach organizations? What type of outreach is taking place? Who is doing the outreach? Law enforcement. Right now, we see that there's a lot of distrust between law enforcement and many marginalized communities. That is likely to ramp up with a lot of the type of legislation that or potential legislation that we're seeing come out of Austin, where we're seeing the likelihood of law enforcement being equipped to also carry out immigration enforcement. And that has a lot of ramifications. The research has shown that it has a lot of ramifications, not just in immigrant communities, but in all marginalized communities. So how is that trust being built and communicated? How is technical, legal, financial information being communicated? How are medical professionals embedded in this type of work? And as you kind of sit with these standards, and one of the things that I would really that we've done that I've done before in a workshop, and I think just led to some incredible conversations, and it was actually really transformative, was really a simple assessment. We did this, and when we actually started using the CLAS standards and some of the planning work that was taking place through Area Agency of Aging, again with Don Smith. But we kind of sat down and we had, two really simple questions that we asked. So we listed out these standards. We did a survey. So this is kind of a suggestion if this is work that you want to look at applying, whether it's across your organization or even just, within within a smaller group. For each standard, ask yourself, how well do we reflect this standard? Give yourself a 1 to 5. How well do we do this? And then how important is it for our stakeholders that we reflect the standard? There may be much more emphasis on, say, engagement than continuous improvement, but if you can look at some type of assessment that allows you to look at both of these aspects of how well you're doing in a given area as well as how important it is, then that gives you a chance to identify maybe 2 or 3 of these standards where you can say, we need to improve, and this is an area that's important for our stakeholders. And so I think the easiest way for folks to kind of begin this work or to advance this work is to really look at where those 2 areas may overlap, and then pick 1 or 2 standards where this is a priority and this is an area where we are not already doing well. We may be doing exceptionally well, but here's an area that we do need some work, and it's important enough for us to make a priority. And just go from there. So it's a toolkit, a set of resources, but hopefully something that can provide some guidance and support along this way. And that's all I've got.
Awesome. Thank you, Marcela. Any comments, questions? That was a good, quick overview of the standards. Anybody thinking about reflecting, doing the how well and how important? I thought that was a really good idea to really dig into it. I don't see any questions. Thanks again, and we'll just move along with the agenda. Very excited to say our program for the 2025 Texas Elder Justice Coalition Summit is completed, and the date is Tuesday, June 10th. We'll be in Fort Worth. Encourage everybody to register. Very excited to have sponsors committed, which will ensure that we are able to provide food and snacks, since our grant doesn't allow us to cover food and snacks. So very excited about that. And there will be volunteer opportunities. More on that later, but start thinking about that if it's something that you'd be interested in helping out a little bit at the summit. Let me know. I'll probably put out a forgot what it's called, but an online sign-up form for different roles. And if you recall, moving on to the next topic, the crypto ATM legislation, these are links on, if you click on the bill number next to the Senate bill information, or the House bill information, the number, you can click on it and I'll give you a little overview of what's going on. The next thing for the 1705 Senate bill is to go to committee, and the next thing for the House bill is the full House vote. I had requested stories and data so that we could, so that I could compile that and share with everyone so that we could contact our legislators, but I didn't hear from anyone. So I wonder if, I guess, if anybody has any comments on the crypto ATM stories and data and their willingness to share anything. Maybe there is nothing to share, or the turnaround time frame was too small or too short, because we were trying to get comments within a day to turn around and share out so that people could contact their legislators about the bills. And I know Detective Jeff Prater, whom some of you are familiar with, he has reported or testified in the cabinet for, I don't remember if it was the Senate or the House bill, and then they were looking for him to comment on whichever one he didn't already comment on. I have some information on it. It'll be in the next newsletter, which is slated for this month, so be on the lookout for that if you like more information. Any comments or thoughts?
Dana, I have a question. This is Elva.
Yeah, go ahead, Elva.
With everything that they could be doing in Austin to help older adults, I mean, crypto ATMs just seems like not a big problem. I think you didn't hear from anybody because we don't know of any places that have a crypto ATM inside a facility. That's my guess, but it just seems like that's not a huge problem for them to be focusing on, to me.
Gotcha. Yeah. Okay. Thanks. And Pat?
Dana, yeah. What bills are you referring to? Because I looked up HB 4238. That one's been left pending, but the one that you mentioned, solar regulations, is that SB 1036? Does that sound
Oh,
right?
that was the one that Ann shared with us from Texas Appleseed last month. Yes.
Well, that's ready for a final vote in the Senate.
Oh, okay,
Yeah.
good.
But
Yeah.
are there any other bills that you know the numbers of that we can be monitoring?
Yeah, one is Senate Bill 1705 and the other one is House Bill 2798. Those are both related to the crypto ATM legislation, and
Okay.
it creates protections for the maximum amount can be with or deposited in a time frame when somebody's a new user, and then there's a lot of specific details about the deposit that have to be included on the receipt, as well as somebody has to be accessible to contact with questions.
Hmm.
And then there is like a time frame for being able to kind of change your mind, or I think it's 72 hours. If they realize that it was a scam, they have 72 hours to go back and um, request a refund, I guess would be the way to say it. So that's my general memory summary of what's in there. They're slightly different with the maximum amounts and timeline, I think. And then they have to be registered too, I believe. So there's quite a bit of protections in it to keep people from, being tricked into depositing money in the ATMs.
Well, I've just looked up House Bill 2798, and it looks like it's out of committee. It's been sent to calendars. So,
Right.
so that's a good thing. I mean, it's
Yeah.
moving right along, but
Mhm.
I mean, I try to keep up with bills.
Yeah.
Thing is, I just came from Austin.
Right.
But yeah, the other one with the virtual currency kiosk, that one's still sitting in committee, and it's been in committee now. Nothing's moved in it since the 13th of March. So people might want to drop a letter to the members of the Business and Commerce Committee, and just send them emails and ask them to get moving and get it heard in their committee.
Okay,
Because
great.
if they don't hear anything, they're not going to move very fast. And sometimes, I know last session I sent a couple of letters and encouraged other people to do it. And finally, one of the bills that was sitting in Health and Human Services or Resources finally moved. So
Great.
if they don't hear from you, they may not know that there's an interest, and there's so many bills filed.
Oh, yeah, there are. You are so right. Yeah, I am starting to, I created some alerts on the Texas Legislature online site so I
Okay.
could kind of keep up with it. I just haven't had time to synthesize all of it yet, but I'll
Yeah. I'm
try
not
to.
impressed with the alerts. They don't always show me what I'm looking for, but yeah, but it's better than nothing at all. I like being alerted when it gets sent to committee or when there's an action taken on it. So, but anyways, just my 2 cents.
Mhm.
There you go.
Yeah, for sure. Thank you. I appreciate you sharing that. And then from what I understand, and I cannot remember who shared this with me, was that they should be, and I wonder if this was national or state. I think it's state, but it may be national. That for the Easter, that legislatures will be back in their home offices next week and the week following. Do you know if that's right?
I do not know.
Okay,
I would
it
be
may
able
be
to
national.
Google it, but I didn't get that. I didn't even think to ask that.
Yeah, that's okay. Anyway, I was um, considering making visits to whomever's around, but
Yep.
anyway, so yeah, more to come. I'll put it that way. And now I'm so excited to share that we have spokespeople for our committees, so you don't have to listen to me talk the whole time. I'm very excited, and I appreciate all the committee work, and especially these spokespeople who are going to give the committee reports. So first up, we have Beth Noah with the Professional Education Committee. Go for
Hello.
it, Beth.
Hello, everyone. Thanks, Dana. Well, as she mentioned previously, we do have the program for the summit is completed. So please make sure that you invite people that you know and or to be a sponsor. I know that I like to print out some of the flyers and have them with me whenever I go to like a networking meeting. And I can also attach them to members of the coalition and other meetings that I go to so we can just kind of get the word out. The more details and the registration are both on the website if you want to look at the program in details or you just want the registration form. And so that is on the website. And if you want more information, you can just email Dana and she'll send you the information via email. Also, the committee, and mostly Dana, has completed the monthly speakers through August. If you can think of anybody or have any suggestions, just send Dana an email about that. And also, one of the things too, and this deadline is coming up very quickly, if you want to recognize somebody for an outstanding person in the elder justice field, the nominations are due by Monday. So if you follow the link in the agenda, go to the website and fill out the nomination form. We don't have any. When we met Monday, we didn't have any. So please, please, please think about nominating somebody. It's a really short nomination form. It's not going to take very long. So please do that so that we can recognize somebody in June.
Excellent. Thank you, Beth. Appreciate it. And now we'll hear from Christy Mina from, is it Mina or Mena? Mina,
Mena.
right?
Mena.
Mena.
Yes, thank you.
Sorry, I've been saying it wrong.
Oh, no,
With
that's okay.
Older Adult Education and Services Committee.
Yeah, so the financial exploitation subcommittee. So we met yesterday and as well as the prior month. Our next meeting is May 13th. So please let Dana know if you'd like to attend that committee meeting. And some of the things that we discussed, first and foremost, the World Elder Abuse Awareness Day, which I believe is June 15th, but we're going to hallmark it on Friday, June 13th, because it's a Friday. And a lot of this is getting spearheaded by Anissa Muhammad, as well as Graciela Ortiz with the Texas Department of Family and Protective Services. And we are looking to light up Texas anywhere we can in the color purple. And we have, excuse me, already specific plans for, I think the Arlington or Dallas area. So anyone correct me if I have something wrong. We did this last year. We have plans also for El Paso and then Fort Worth and Houston. Whether it's a building downtown, we're going to try for the Star on the Mountain in El Paso. But I think also more importantly, we are going to attempt to get some news coverage from it. And usually if you can light something, a landmark, if you will, purple, then we can get a story in the paper and we can talk about World Elder Abuse Awareness Day. We also talked about the Stop the Stigma campaign. And I think there was an attachment, I believe, to today's meeting that addressed that. And there's an example from Rhode Island, and we were looking to customize that for Texas and maybe align it with the summit as well as the World Elder Abuse Awareness Day. So please check that out. Back to the Speaker Bureau, and I'm relatively new here, so this is referring to what was just talked about by Beth, right? Those that may have indicated that they would like to have presentations on their community. We're working on setting up a request via the website so that then some materials and the mechanism for a presentation could be provided to you. And then the last thing is the what to do, quote unquote, wallet card. And that was attached this morning to an email that Dana sent. So that's ready for some feedback. And again, that's, what to do if you suspect, or there it is, to see that there's been, a situation of financial exploitation of our older adults in Texas. So thank you.
Yeah.
Again, the next meeting is May 13th.
Yes. Perfect. Thank you, Christy. And this is based on feedback from last month about readability and size and simplifying the message. So open to feedback on the draft here. The idea is that we would have some printed out and then distribute them at the summit, or allow people to print them on their own, and hopefully make sure that every person that knows an older adult has one on hand, maybe a few to share, and to share with older adults who can share with other older adults, so that people know what to do, because that's one of the feedback that I've heard often is people don't know what to do. Thoughts, feedback, missing anything? Easy enough to read. It's probably a little bit bigger than wallet size on your screen, but that's the intent, business card size, basically 2 inches by 3 inches, or 2.5 inches by 3 inches. Does that mean everybody loves it? Yay!
It looks very nice. Thank you. It looks very nice.
Oh, thank you. I don't know who said that, but I appreciate that.
Shirley Trapani.
Oh, okay. Thanks, Shirley. Yeah.
Hi.
Hey, excellent. And we have our, let's see, next committee, the collaboration committee, and Patty Taylor's going to share. Oh, I see Paula sorry, Patty. Paula just asked about accessing it. So once it's blessed, which I feel like it's blessed at this point, since nobody's said anything, we did talk about doing like a trial run first, and then trying it out. But basically what I sent out is the same version that I just shared on the screen, and it's has the print cut marks on it, so it should be you should be able to send it to a printer and ask them to print however many copies, and they should be able to do it. Happy to resend or send in a different format if it's needed. But yeah, you can just ask, just let me know what I can do. I'll probably send it out again at the next meeting. Let's see, seeing another chat, but I can't read the whole thing for some reason. The law include, age 65, not over 60. Oh, 65 and over. Is that what you're saying? And not over 65. I think that's what you're saying. Okay. Thank you. No, that's every little comment or correction is very helpful. So I'll update that 65 and older, and resend it to everybody. Thank you. All right. Any other comments, questions? Patty Taylor is our spokesperson for collaboration committee. All right, take it away, Patty.
Thanks, Dana. So we met on Monday, but before I go into that report, I don't know if you saw in the chat that I recently found out about this automated way to contact your legislative representatives. It's a resist bot. It's free to use, and it helps you formulate letters. So this is kind of good to have in your back pocket for anything in the future.
Oh, awesome.
So we met the collaboration committee on Monday, And if you remember back in March, Dana sent out a survey. What we're trying to do is get a list of all of our members for each other to use so that if, I needed a contact for something, then I can look it up. It's going to be an Excel document. And so you can search with it. We're trying to make it as easy as possible, but we really want to make sure it doesn't turn into spam email or anything of that sort. So we're thinking of ways maybe to password protect it or send you a code for only the committee members to be able to get access. So we're looking at a couple different things like that. We had 81 people answer the survey, so thank you to those 81, but there are 161 on the email list. So we're missing about 50%. Dana is going to, in all her spare time that she has, she is going to go through the list and try to identify who hasn't answered and maybe reach out to them directly. And we, do you have the density map that you could show, Dana?
Yes.
So this is really cool what you did here.
That part, yeah.
So here is the density map of Texas. Our goal was to have 3 representatives from each region, and you can see there the numbers, region 1 has 0, region 2 is 0, 4 is 0. So if you know of anybody in these regions that we could possibly reach out to join us on this collaborative, we sure would appreciate it. And it might help. I mean, most of these you can see. Number 5 was that's the Nacogdoches Beaumont area because there's no city landmark there. And number 10 is obviously Big Bend area. So if you know of anybody, reach out to Dana or anybody on the collaboration committee. And with the email, one thing that she is doing is having an orientation meeting once a month. And that's like a 20-minute introduction to what we do. And so anybody that we think may be interested, she's been inviting them to this introduction meeting and it's going very well. She actually has gotten 9 new members since January. So that's awesome. And that's because of all of you being able to use your connections and bring in everybody for the same cause. Let's see, I think I covered everything. We do have a flyer if you have a contact that you might want to reach out to and give them a little context on what the TEJC does. If the flyer does help for that initial meeting and hopefully getting peaks of interest through that. So did I miss anything, Dana?
No, you did excellent. Thank you. Appreciate it.
Thank
Hopefully
you.
everybody enjoyed hearing from some other people today. I know I appreciate getting the chance to just kind of, I don't know, step back a little bit. And it looks like we filled our time. So quickly, I'm going to mention we have been meeting as a resources/sustainability/summit sponsorship committee, and that's been going pretty well. We hope to be able to identify other sponsors to help us keep this great coalition going, or other grant opportunities. If you see anything or hear of anything or think of anybody, please let me know. Skip over the grantee meeting. I'll save that for next time. Social media, the numbers keep ticking up just a little bit at a time, and we have our speakers lined out for the next few months. And any new business announcements, thoughts, questions, comments on anything prior? Anyone? Not seem like it. All right. Reach out to me if you have any thoughts, ideas, comments, suggestions, people to invite. Just let me know. And thank you all. I appreciate your time and look forward to seeing you next month. We'll have a great speaker talking about the, oh, my mind just went blank. The trauma-informed language, about helping people with who've experienced financial exploitation. And then in 2 months, literally only 2 months away till the summit, and very excited about how it's coming along. Definitely recommend registering as soon as you can so we can make sure that the planning goes smoothly. All right. 2 minutes back. Wait, did anybody else have a question? Oh, Lynn has a question. Yes, Miss Lynn.
I just wanted to tell you thank you. Great meeting, and thank you to your committee chairs.
Thank
It was
you.
great.
Yeah, for sure. I agree. Wow, look at that Fireflies note taker in the chat. That's something. I'll have to see how accurate it is. Thank you again, everyone. Talk to you soon.
Bye.
Bye.
Bye. Thank you.